Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you very much for having me on the program.
Yes, sir. Yesterday, we would have received 38,400 vaccine doses from the COVAX facility. Well, we know immediately that this is going to bolster our immunization capacity. And as you rightly said yesterday, this would also complement the 24,000 that we had previously gotten. I know once persons go out and get their vaccine, this brings us a little bit closer to achieving herd immunity. Could we get your general thoughts?
Well, first of all, we want to thank COVAX for sending these 38,400 doses. As you know, they have promised us to give us about 100,800 doses. And so this is making good on that promise of getting us to about 20% of our population. So we are very thankful that we were able to get these doses yesterday. And we want to thank all the partners of COVAX, including many of the governments who have donated generously to COVAX. The United States, as you know, is the largest donor to COVAX. And through their assistance, that's how the 92 countries who are getting vaccines from COVAX free of cost, and Guyana is one of them. So we are very pleased to receive these doses. The dose that we receive, or the doses that we receive, are AstraZeneca doses. These ones were manufactured in South Korea, and we would be utilizing them across the country. I think most people are familiar with the AstraZeneca vaccine by now because that's the first vaccine that we've started using. And after your first dose, you have to wait between 8 to 12 weeks to get the second dose. So we are seeing a lot of people right now who would have received their first dose earlier in the vaccination process, now coming back for their second dose. And again, I want to assure everyone that we have enough of the second dose for those who got their first dose. So we will be rolling out the set that we just received to different regions. And I do hope that people can come forward and get their vaccine.
Okay, thank you, Minister. As you touched on the AstraZeneca, specifically as this is the vaccine that we received, just if you can, and we have discussed it before, the reason why the period is so longer than the other vaccines that we would have used, the Sinopharm and of course the Sputnik V now.
So in the scientific discussions that were tabled at the WHO, we know with AstraZeneca, the efficacy is around about 62%. But if you increase the dosing interval to between 8 to 12 weeks, then the efficacy can go up significantly to about 82%. And so that's why in our recommendation, we prefer to have the longer interval rather than the shorter one. So that's why we are using it in this way. So I think the results that we've been getting so far, a lot of people have been coming back for their second dose, and that's quite encouraging.
All right. Just two other things on the same vaccine. I know, I think Dr. Codina had said that we were supposed to receive 40,000. That would be the next batch. Just a bit of clarification there.
Yes, well, we are expecting the additional doses, and hopefully we can get that sooner rather than later, because there is a momentum with the vaccination process. So as fast as we can get that, we certainly want to roll that out so that people can get their vaccines.
Of course. Before I ask you on just an update on the figures that we have thus far, I just wanted to ask you, we're at about roughly 32% of the adult population in Guyana being vaccinated, but you had expressed concern that persons weren't coming forward fast enough. And I think this was something that you saw for yourself when you visited Region 1 yesterday. So could you tell us a little bit about that?
Yeah, so I mean, as of yesterday, we have had 157,797 persons who have received their first dose of the COVID-19 vaccine. That would approximate to about 32.4% of our adult population. So it means really that we still have a far way to go if we are going to get to herd immunity. At the same time, we have also been able to administer 13,010 doses as second dose for people. And so those 13,010 persons can be considered to be fully immunized. So that's a process that we have to continue to make sure that we get all those who received their first dose to get them to take their second dose. Now, when we examine the disaggregated results from the different regions, there are lots of differences. So for first dose vaccination, we still have region 10 being the lowest at 9.3, followed by region 8 at about 18%. We also have, on the higher end, we have region 6 that is at 38%, which is good, and really we want all the regions to be at that level. So there are discrepancies, well, not discrepancies, but there are variations in the uptake of these vaccines. And so for region 6, you have 38.9%, and that's at the upper end, followed by, well, and at the lower end, you have region 10, which is at 9.3. So we have to work very hard to get people to understand the importance of getting their vaccines. Most of the other regions are in between these two extremes, and most of them would have fallen within the 30s, right? With the exception, therefore, of region 8, which is at 18.8%. In terms of the second dose, again, now that many persons would fall due for their second dose, on average, we have about 2.5% of the persons getting their second dose. But again, we see variations in how people are coming back for their second dose. And that's something that we want to encourage, because on the upper end, we have 3.9% of persons in region 2 have returned for their second dose, while in region 1, we are just at 1.2%. So again, for those who have already received their first dose, the process does not end with the first dose. You have to come back and get your second dose. So that's something that we have to appeal to people to get their second dose as well.
Okay. If I can ask you, Minister, with respect to Region 10 and Region 8, I know Region 8 geographically, how it's spaced out, and that could possibly pose a challenge, but I don't, from what I know of Region 10, I don't see that being the same reason.
Well, there's in Region 10, from the outreach that we had, there are people with different myths, misconceptions of the vaccine. So again, we have to continue that education process, and hopefully people will get a better understanding and come forward to get their vaccines. Some of the myths to most people might sound very absurd, but nevertheless, if people hold these beliefs, then we have to work with them to undo them, so that they can understand the benefits of these vaccines.
All right. I know we've talked a lot focusing on the vaccine in terms of monitoring the various regions. I know there's still stuff in place for that. How has that been going?
Well, we continue to monitor, and one of the things, though, that people would, should understand, that vaccination protects people. Vaccination would reduce your burden of the disease. It would reduce the severity of the infection, reduce hospitalization, and reduce the possibility of dying from COVID. So there are many advantages to using the COVID-19 vaccine. As we speak, we have more than 145 cases, active cases of COVID-19 in Region 10. And you have about 5 persons who are in the hospital. And we have also had in the past, we have had deaths from Region 10. So we know that we have something that can prevent this from happening, and that is the vaccines. And therefore, we have to do a lot more work, not only the Ministry of Health, but all the persons with influence in Region 10 and in other regions as well, to talk to people, to encourage them to get vaccines, because by doing that, we are going to protect people and we are going to save lives. So it's really important that we have this conversation with people and help them to understand the benefits of taking the vaccine. So it's not just the Ministry of Health, it's everybody got to get involved in this to make sure that people understand these benefits.
Okay, Minister, thank you so much. I have one question from HGP Nightly News. They're basically saying the Vice Chairman of Region 7 has alleged a major drug shortage at the regional hospital. Can the Minister confirm whether this is true and what efforts are being made to restock the hospital?
Well, I'm not aware of a major drug shortage. Major sounds like if there are a lot of things that are short. We do have some shortages, and as you know, we have constantly explained this. We inherited a bad situation with medicines, and we have been working to fix that. As far as I'm aware, of most of the essential items that hospitals would use, we have been able to restock that. There might be a few items that are short, but we are continuously trying to procure those items. And as fast as we get them in at the MMU, we then distribute them out to the regions. So there might be a few items that are short, but certainly it's not a major shortage. And across the health system, we have been sending out medicines. As you rightly said, I just came back from Region 1, and one of the things that I went and I checked there was to make sure that I go to the pharmacy to see whether or not they have medicines, and in fact, they do have all of the essential medicines. So I suspect the same might be for Region 7.
And just last week, we spoke about this because you were given a preview of the report that will, I think this week they're supposed to give you the final report that the auditors did in terms of how much drug were expired and so on in the regional bonds. I believe Region 7 was about 40.7, I think.
Yes, we had a lot of expiry in Region 7, and at the same time, while they were making the assessment of what expired, they also did an assessment of how many drugs and medical supplies they currently have in the system, and it far exceeds what was expired. So I know for sure, based on that audit, that we have a lot of medicines in Region 7.
All right.
The other thing, too, that we should note is that through the budget, regions are allocated funding for medicines, and generally they would send back those funds to the Ministry of Health so that we can do bulk purchases. And while we are proceeding to procure medicines for all the regions, we are yet to receive the funding from those regions for their medicines. So perhaps that is something that the regional chairman might want to look into.
Yes, sir. And there is something specific that you mentioned last week, and I think that we should mention it again. You had indicated that for these particular regions, it slipped me what I wanted to ask. Oh, actually, I believe you had indicated that sometimes it's not that the drug is not there, it's just that another drug is being prescribed. Right? I know you had raised that.
Yeah,
something
that is their doctors have preferences for medication. And so while we would procure with, say, essential lists, if that is not that particular doctor's preference, so for example, let's say for hypertension, there would be meds for hypertension, but if those meds are not a particular doctor's preference, then you can have those meds, and if nobody is prescribing them, they would remain in the bond or in the pharmacy. So sometimes we have to reconcile the two and make sure that we understand the prescribing patterns of these doctors, as well as the doctors must understand what they have in the pharmacy, because you can change your prescribing pattern to suit what you have, and you can accomplish the same thing, and that is ready to control the condition that the patient has.
All right, Minister Anthony, thank you so much for indulging us yet again. All right, well, that's it for today's COVID-19 update. Of course, we just spoke to the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.